You've made the smart decision to schedule a hearing consultation. That's a major step toward taking control of your hearing health and improving your quality of life. But your journey doesn't end at booking the appointment. To get the most out of your visit, you need to come prepared with questions. What type of hearing loss do I have? This is the foundational question that will shape every other part of your care plan. How severe is my hearing loss? The severity of your hearing loss determines not only your eligibility for hearing aids, but also which features and styles will work best. Do both ears have the same hearing loss? It's common for one ear to hear better than the other, but when the difference is significant, it's known as asymmetrical hearing loss. What does my hearing test results really mean? Your hearing test results are not just numbers. They represent how well you engage with the world around you. Understanding your results is key to understanding your needs. What are my treatment options? Hearing aids are the most common treatment, but they aren't the only one. Ask your provider to explain all possible options based on your test results. What's included with the hearing aids? Buying hearing aids is an investment, and like any investment, you need to know what you're getting. How long will these hearing aids last? Hearing aids don't last forever, but asking this question helps you prepare for the future and take better care of your devices. What happens if I don't like the hearing aids? Not every hearing aid is the right fit the first time. That's why you need to ask about trial periods and return policies. Does my insurance cover this? Hearing aids are an investment in your well-being, but they can be costly. Ask your provider to help you explore coverage options. Ready to take the next step? Now that you know what to ask during a hearing consultation, the path forward is clear. Asking thoughtful, informed questions puts you in charge of your hearing health journey.